guys, it's I don't even know what day it is. I guess we're Friday. I wanted to just update everyone on how Brian's doing. I know the last video I left was kind of heavy, or not video, but just text. So just wanted to follow up on that with you guys. Obviously, Brian did not come home on hospice. We are actually at Utah Valley Hospital right now. They transferred us. So Brian has been requiring a lot of blood transfusions and platelet transfusions, as well as plasma. And the Spanish Fork Hospital was struggling to get platelets and from, I guess, Red Cross. So, I mean, so much so that the other night they called to get some more, and I don't know the situation that happened, but basically they ended up waiting an extra several hours, like 6 hours, to take more blood work before they could get it, I guess. And the nurse came in and gave Brian his Granex shots, which is supposed to help increase his white blood cells and all that stuff, which, by the way, it's not. It's taking forever. Anyway, I'll tell you about that in a minute. But he gave him a shot in his stomach, and he actually got a hematoma the size of a lemon on his stomach, which required us to go downstairs and get a CT scan to make sure it hadn't broken through his abdominal wall. And we end up finding out that his platelets were down to 3. So normal platelets are 150 to 400 is where you should be. So yeah, when he got that Granex shot and hematoma, it was out of 3. We just got his labs back. He's been having the platelets, everything, and his platelets are not coming up. He actually has no platelets right now. They said he has less than 1 platelets, and he's had 2 to 3 transfusions daily of platelets. His white blood count finally went up to 0.7. I think it needs to be like 3.6 or something like that. And then his neutrophils have started to come back as well. They're at 0.4, and I think they need to be at 1.7 or something like that. So, I mean, things are starting to wake up, but he's still not out of the clear yet because he still has that intestinal bleed. And now that he doesn't have any platelets, he's at risk for bleeding out, and there's no way for them to stop it. I was waiting for his oncologist. They moved us to Provo because his radial oncologist as well as his oncologist are both at Utah Valley, and his oncologist is actually a hematologist, and so dealing with blood work. There's some controversy whether it was the Timidar or like the Bactrim that caused it. Timidar usually doesn't cause immune suppression. So yeah, anyway, so we're just trying to figure that out, but his body isn't responding. However, both oncologists, one yesterday and one today, said, when I was walking over here to see you, I really thought that you were going to be way worse than you are. So we are, he's doing better. But with that being said, I kind of want to give you guys an idea. So when I got the call on Sunday about his internal bleeding, I knew something was up because he was doing so good on Saturday. And then about 1 o'clock in the morning on Sunday, he woke up and was super agitated, couldn't get pain control. His heart rate went up to 130. His blood pressure dropped like 95 over like 50 something. And he was having, just agitation and everything. And he was having a lot of output, but nothing showed blood. So of course he wasn't bleeding. But then I finally asked Addie and Corbin to come sit with Brian so I could go home and shower. I ran home and showered, and we hadn't slept all night again. Like, we are getting maybe 1 to 2 hours, and it's not even like great sleep. because of his blood transfusions. He's requiring so many, and then they have to come in and hook it up and stay for the first 15 minutes, and then you have to do vitals every 15 minutes, and so it's just a lot. But dang it, now I don't remember what I was telling you. Anyway, yeah, so I went home to shower and get a little nap. On my way back, you can kind of hear I've been hoarse. I was worried that I was getting sick, and so starting, I think the day we ended up taking him to the hospital, I started taking my immunity boost injections to help me not get sick, which I didn't. So I've just been taking them every day I can just to boost my own immune system, because I need to be there with him. So I ran to the office to do that, and on my way there I get a call from Bryans' cell phone, and the doctor said he is bleeding a lot, basically. And so of course I rushed back to the hospital. By the time I got back there, they had kind of, I guess, regrouped. They were trying to determine what they needed to do for him. By the time I got there, they had decided that they could likely keep him at Spanish Fork, which, by the way, the staff there is so amazing. I mean, they were so good to us while we were there, and I appreciate them so much. But they ended up having to do back-to-back blood products. So going back to what I said, to put this in perspective, most of us have about 10.5 pints of blood in our body, you know, give or take, depending on the size of the human. That night, between 6 p.m. and 7 o'clock that next morning, so just over 12 hours, they put 9 pints of blood product into him. That was red blood cells, plasma, and platelets. And they were literally doing back to back to back. And when the doctor came at 7, that's when they were talking possible hospice, because even doing back-to-back infusions, they weren't able to keep up with his loss. However, because I know you guys were praying for us, and I know that, you know, he did slow his bleeding. So from about 3 to 6 p.m., so 3 a.m. to 6 p.m. on Sunday, he actually didn't have any bleeding episodes. That didn't mean he wasn't still bleeding, because his hematocrit and hemoglobin were dropping. And so, and then about 6 o'clock Monday night, he had about 5 more episodes, but they only gave him, I think it was 2 pints of plasma and 2 pints of blood, but that's still 4 more pints that they put in him. And then each day he's had 2 to 3 infusions. And like I said, his platelets just keep dropping. And today he has none. So I'm hoping that will turn around significantly. He's doing okay, very fatigued and tired. Has to be transferred into a chair, can't stand on his own. He's still on clear liquid diet. We've tried to give him some food here and there, and he ends up throwing it up. So yeah, we just have to wait for that intestine. So he's got small bowel enteritis, and so his intestines are so swollen that they're worried about ischemia, not getting enough blood to his small intestine. So far that hasn't happened, so he's doing good, but he is still bleeding, and so we have to, they said we probably won't be able to leave the hospital till he has very little to no blood in the stool, especially if they send him home with low platelets. Some clients can go up to 6 months without, with neutropenia. So this may be something that we just have to deal with for the next little while. So that's kind of where we're at. I'm heading into work. His sister's with him today to visit. His mom was here for a few days with us. He is not in ICU anymore. They put him on the 9th floor in Provo, but he's very prone to infection, like I said, because he has no immune system. So his white blood cells, his neutrophils, his lymphocytes, which are the white blood cells, is what part of white blood cells as well, and then monocytes are all 0. They were all 0, and they've been 0 until, I guess, yesterday they started creeping up. So, like I said, white blood cells are 0.7 today, which is great. I'm gonna be happy about every little thing that, you know, happens. It's a win. And his neutrophils were 0.4. So he's starting to wake up his immune system and bone marrow. So I'm crossing my fingers that, you know, we can get this platelet thing taken care of. I was trying to wait for his oncologist, but he didn't come, and so I left some questions for Brian to ask and his sister about, you know, other medications for platelets and different things. So I've just asked Brian. We're still touch and go, like I said, because he can bleed at any time, and if his bleed starts bleeding again and they can't get it controlled, then with, you know, as low as his platelets are, we just, all right, so we're kind of at a wait and see at this moment. And yeah, I think that's pretty much all the update I really have for you guys. So still here, not really able to do a whole lot of daily cares for himself. It really wears him out even just to brush his teeth. And they're not even talking about possibly even letting us go until Monday, and that's based on bleeding and other things and what they can figure out with platelets. So we'll just see. We'll see how things go. But I hope you guys have a fabulous day. Like I said, I'll keep you updated. We literally just have not had sleep, and we've notified people, you know, family and everybody who really needs to know how he's doing, and then the other stuff just has to come after, because I just don't have the energy to keep up. I'm up with him multiple times per night, and yes, we're in a hospital, and yes, the staff can do it, but it's hard on patients. Just knowing it as a nurse, it's hard on patients when you're sick, and then you have somebody who has 3 or 4 other patients who are just as sick as you are, and they're trying to get you to the bathroom, or they're trying to get, you know, things. It can make things have to be speedy a lot quicker than they should be, and it wears you out even more. So I do all of his cares just to give him enough time to be able to do it as slowly as he needs. Throughout this process, luckily, since the first night, his vitals have stabilized, which, you know, I mean, it's kind of like when you get labs and the doctor's like, there's nothing wrong with you, your labs are fine, right? But they have been stable, so we are happy about that, because I really look to those to tell me if things are changing. I really just want to get him back home, hopefully, and get him back on treatments such as the hyperbaric chamber, that kind of thing, to help make things better. So please keep calling and texting, and the one thing everyone keeps asking what we need, please continue to pray, you guys. We feel your prayers, and they're just blown away that Brian's honestly still even here. So we are filling them, and they are working. Now what outcome will happen, we still don't know, but there's so many people praying for him, and he is like, I mean, if you guys were to see him, you would see how, you know, his color, everything is still, he's kind of yellow white, and he has bruises all over because he's bleeding under his skin. Like if I touch him, he can bleed. It's just so he's definitely debilitated, but for what he's been through and all the blood transfusions that he's getting daily and still losing blood, and I mean, he's doing amazing. So we're very happy with that. We're going to continue to pray ourselves on what needs to happen, but continue to pray. Prayers are being answered. He's getting better. So pray that his platelets will start going up, and that he won't continue to have bleeding issues. His bleeding has slowed, like I said, but without those platelets, it's going to be difficult. So just keep praying for that, and I will follow up with you guys another day or so. And again, I'm sorry it's taken so long to get back to you guys. It's been a lot. It's been a lot of stuff that we've had to do, and you know, going back and forth from work and going to the hospital and making sure that I'm there with him, you know, all night and all day, or that someone else is sitting with him. So, but also we have to be super careful on who does that, because his immune system's gone and he bleeds easily. So, you know, we can't have him up and walking and falling and all that stuff. So, anyways, I'm gonna head home, check on the dogs, maybe get a shower, head to work, and then I'll head back up to the hospital. Again, feel free to text and call, but I would not just please show up to the hospital. Just let us know. Of course, we're letting close siblings in, no kids. We can't have people coming that are sick or anything like that. So, and visits are, you know, if you do come for something, we're keeping them very short because it wears him out. So, all right, you guys, I hope you have a good rest of your day.